Hello and welcome to today's pandemic update video for Tuesday, February 7th, 2023. We do have one COVID positive to report today. Kirk Watson, who is the mayor of Austin, Texas, tested positive back on Saturday, February 4th of this year. He is 64 years old. And we also do have two COVID outbreaks to report about now that are ongoing. The first one is Minnesota-Illinois game postponed for COVID in the Gophers program. So the Gophers reported that they are having an outbreak of COVID cases, and they have moved into COVID protocols. Sounds as if like they had a lack of players, and there's not enough players now to play the game because of the parent COVID positives that they have. Don't know precisely how many positives there are, but it was enough that they had to cancel or postpone a game. Also, COVID keeps hitting Ohio's largest public corruption trial. That's right, there's a corruption trial that's been going on in Ohio, and it already got halted once because of COVID cases. I believe it was suspended for 4 days or postponed for 4 days, and then it continued, and well, guess what? They're having more issues with COVID. COVID has hit them once again. All right, moving on to the CDC transmission map. Taking a look at the transmission map here, you will see 61.11% of the country's counties are in high transmission. Substantial transmission makes up 19.55% of the counties. Moderate makes up 14.3% of the counties, and low makes up 5.31% of the counties. The majority of the counties in high transmission are in the southeast and in Puerto Rico. The Northeast is a mix of high and substantial transmission, while the central states on through the western states is just a general mixture of everything from high, substantial, moderate, and low. And high transmission does fairly dominate in Alaska, with the southeastern portion of Alaska being in moderate to substantial transmission. Moving on to the varying proportions. We're just going to do the top ones here. And the XBB.1.5 variant still dominating at 66.4%. BQ.1.1 comes in second at 19.9%. BQ.1 is at 7.3%. XBB is at 2.3%. CH.1.1, the variant out of Europe, which is prevalent here in the United States now, is at 1.6%. And BN.1 is now back to 1.1%. All right, moving on to New York State, 1,729 new cases today, 4.6% positivity, and the 7-day average is 5.4%. Taking a look at New York State hospitalizations, they're pretty much just dropped ever so slightly from the previous update. Interestingly enough, ICUs have increased. So there's currently 2,384 people in the hospital. ICUs are at 278. That's actually up from the 264 that they reported on the previous update. So that's an increase of 14. Taking a look here at the Walgreens map, you'll see here, for the most part, there is more green than we saw last week. That's a good thing. That means there are areas with dropping positivity. So let's run through some of the states, shall we? First, we'll start with Maine, like we often do. And Maine was dropping. Now they're up 0.2%. The current positivity is 34%. And as you can see here, for the most part, the northeastern states are not really rising all that much. Let's take a look at Connecticut. Connecticut, 31.1%. That's a difference of 2.2%. But look at last week, 28.9%. Look at the testing. Testing is down in Connecticut. 148 total tests. Prior week, 204. Massachusetts, what's going on there? Massachusetts, 37.6%. Again, they were rising, but that's starting to slow off now. Prior week, 36.5%. Difference of 1.1%. Again, testing is less than last week. Now, we're going to move on to some states that are really noticeable in the rising department. Take a look at this. Montana, 34.4%. 5%. Increase in testing from last week, 29 versus 27. Last week's positivity was 25.9%. That's a difference of 8.6%. How about Utah? Yes, Utah is rapidly rising. 31.9% positive in Utah. Take a look at the prior week. 23%. Prior week, that's a difference of 8.8%. 182 tests this week. 178 tests last week. So, yes, testing is up there. How about Alaska? Alaska, yes, testing is less than last week, but it's only less by 3, and quite frankly, I don't think that matters too much. Current week positivity, 44.6%. Prior week, 33.9%. That's a difference of 10.7%. So yeah, I think it's safe to say this probably would be a legitimate rise. Taking a look at Alabama, 37.3% this week, 31.2% last week. Difference of 6.1%. Total testing is down, though, significantly. 260 tests this week, 333 last week. Let's take a look at Arkansas. And yeah, here we go again. Current week, 28.9%. Prior week, 24.5%. Difference of 4.4%. Total tests this week, 38. Total tests last week, 106. That's a significant decrease in testing. Now, here's one that's concerning again. Indiana, 33.7% this week, 29.4% last week, difference of 4.2%, but look right here. Big increase in testing. 466 tests this week, 377 last week. So, yes, they're rising. So, it is really state to state on, while some states are legitimately dropping, some states are legitimately rising. Let's take a look at Kentucky. Kentucky, tests are down. 379 tests this week, 440 last week. Current week's positivity rate, 39.8%. Previous week, 36.1%. Difference of 3.7%. So 2 things to take away from this real quickly. Number 1, I think we need to do a video linking on the areas that have rising XBB 1.5 levels. In other words, areas where the XBB 1.5 variant is just starting to become dominant. We want to see if there's a link to that and places that have rising positivity. Number 2, states that have a legitimate rise on the Walgreens map, I think we want to start paying attention to see if a new variant that's not XBB 1.5 and is something else pops up. Indiana's a good candidate for that. Montana is possibly a good candidate for that, although not Montana. Yeah, Montana, you could also say maybe that falls into the category of is XBB 1.5 finally taken over there. But a state again like Indiana, that's suspect because 1.5, at least last update we looked at, was dominant there. So the fact that they're rising, there could potentially be a new variant there. All right, moving on. We got a couple other things to look at today. Let's take a look at deaths. We haven't updated deaths since our last update. Back on February 2nd, there was actually a day with over 2,000 deaths again. February 3rd, 139 deaths. 4th, 10 deaths. 5th, no deaths. Today, 176 deaths. Why is 176 deaths significant for today? Let's go back to last Monday. 155 deaths. So today's death number is actually higher than last Monday. That's not good. Skipping over to international update because I want to bring this to your attention. The HHS has ended their coronavirus hospitalization tracking page. We can't see the hospital capacity on it anymore. We can't see the number of COVID patients, the percent of beds being used, all that. It's ended. Effective February 2nd, 2023, the Centers for Disease Control and Prevention, CDC, in partnership with the U.S. Department of Health and Humane Services, streamlined the sharing of COVID-19 data into one easy-to-use platform. Yeah, easy to use. Look how many different links there are here. There's several different ways you could get it. Those who are data junkies and like to update, charts and different data on website, I'm sure it's going to be easy for you to get. Me, I'm not one of those people. And to the average person, having all these different links, It's ridiculous. Are the COVID hospitalizations in this country at zero? No. And until that should ever happen, which it will never happen, they need to keep this going. And I think because of this, less hospitals are now going to be inclined to do it. All right, so that's all I have for you guys today. We'll probably do a video. Like I said, we're probably going to do a video tomorrow linking the positivity rates on Walgreens to what the actual varying proportions show in each sector of the country. And plus, we'll also do the pandemic update video tomorrow. All right, see you next time, and please remember to hit that like and subscribe button down below if you want to see more content like this that could be very life-saving to you. Take care, everyone. Stay safe.